The stiffness you feel when you wake up is not a sign of aging. It is the first warning that your hip is losing circulation and entering silent degeneration. This process begins years before sharp pain appears, when the nervous system decides to lock the pelvis to protect the body from what feels unpredictable. What few people know is that there is a 3-layer weekly protocol capable of interrupting this path before it ends in a prosthetic, but it only works when it is practiced in depth. Most people only practice the superficial layer, the one that brings relief for a few days, and they never discover what happens in the deeper levels where the hip restores real circulation and the nervous system learns to trust movement again. There are 3 progressive layers, and each one reveals something the previous one cannot reach. Repeating this every week is what prevents years of physical therapy. Ignoring it is preparing the body for the surgical table. Hip degeneration does not begin in the bone. It begins with the loss of mechanical circulation, when the joint stops receiving the movement that nourishes it from the inside. The acetabulum and the cartilage depend on rotation, controlled load, and decompression to stay alive, like a river that must keep flowing so it does not dry out. When the nervous system enters chronic protection, it conserves movement, reduces range, and locks the pelvis, creating an articular silence that slowly turns into stiffness, then pain, then degeneration. Ancient traditions that preserved the pelvis as a center of life understood that the hip was a portal of support, not just a mechanical joint. They knew that what does not circulate becomes dense, and what becomes dense turns into destiny. That is why they maintained weekly rituals of rotational movement and pelvic decompression, simple gestures that prevented the body from cooling internally and losing confidence in supporting its own weight while walking. Polyvagal neuroscience reveals that when the body detects instability in the hip, the nervous system prefers to lock the base rather than risk the unpredictable. The psoas hardens like a guard, the gluteus medius goes offline, the breath rises, and the abdomen becomes armor. The hip stops rotating not because of mechanical failure, but because the body chose protection over flow. Reversing this requires going beyond superficial relief.
When the pelvis loses confidence in rotating and supporting, the entire body begins to conserve movement, and over time, this restriction spreads into the way you create, move forward, and inhabit your own life. The guide, Healing in Motion, 22 somatic cycles to release trauma, restore flow, and create again, works directly with this territory of deep restoration, returning to the hip and other body axes the capacity to flow again. This material was created based on all the studies developed for the channel, with care and depth. The link is in the first pinned comment, and I recommend checking it after the end of this video. The hip loses rotation before it loses strength, and it is through rotation that circulation returns. When the femur rotates inside the acetabulum in a controlled way, it distributes pressure, bathes the cartilage, and reactivates the synovial circulation that keeps the joint alive. Starting here is giving the body back its most basic and most forgotten gesture, the one the nervous system shut down to maintain control. Without this weekly movement, degeneration advances in silence. Stand upright, feet aligned with your hips, knees soft without locking. Place one hand on the right hip bone and allow the femur to slowly rotate inward, as if the knee wanted to turn toward the center while the heel stays grounded on the floor. Let the breath descend into the lower belly without forcing expansion, simply feeling the abdomen soften as the movement happens. Repeat 5 times on each side, mapping where the rotation feels blocked or where it slips. If you do not feel anything in the first rotations, reduce the range by half and slow the gesture down even more. Some bodies respond better lying down, with the knee bent and the foot resting on the floor, allowing the thigh to roll inward and outward without shifting position. What matters is not the size of the movement, but sensing the bone gliding inside the joint, like an old door returning to movement on its hinges, smooth and without noise. You will know you have crossed it when you notice more range as you rotate, a subtle warmth in the hip, or a spontaneous sigh rising from the abdomen without effort. The body begins to trust that it can move without threat, and morning stiffness may already ease by the next day. Most people stop here, relieved by the return of mobility, but the hip still lacks the deep stability needed to sustain that rotation without compression.
Restoring rotation is not enough if the hip does not have the strength to hold that range without collapsing. Here, the body needs to wake up deep stabilizers that have been silenced, the gluteus medius and the gluteus minimus, muscles that support the pelvis without compressing the joint. When they shut down, the hip compensates with tension in the psoas and the tensor fascia lata, creating an overload pattern that accelerates wear. This resistance is normal. The body learned to protect itself by locking, not by supporting. Stand near a wall and lightly rest your hand on it for balance. Shift your weight onto your right leg and press the foot into the ground as if you were pushing the floor away without actually moving, keeping the knee aligned with the ankle. Hold this pressure for 6 to 8 seconds, feeling the lateral glute activate without hardening the abdomen or pulling the breath up into the chest. Switch sides and repeat 3 times. When you feel the urge to compensate by sending tension into the neck or clenching the jaw, reduce the pressure by half and keep your attention on the heel. The body tends to seek strength where it already knows it, in large, fast muscles. But what you need here is quiet support, the kind that holds without gripping. If the breath rises, pause, release the air slowly, and begin again with less effort. You will know you have crossed it when the hip feels firmer while standing, as if something inside the pelvis has woken up to hold the weight without locking. The sense of instability while walking decreases, and the body begins to trust that it can sustain movement without collapse. But there is still one more step, releasing the anterior compression that keeps the joint under constant pressure. Your hip now has more rotation and more stability, but as long as the psoas remains contracted, it will keep pushing the head of the femur into the cartilage from the inside, like a weight that never lifts. This anterior tension is what allows degeneration to continue even when you mobilize and strengthen. Decompressing the psoas is not stretching. It is removing from the pelvis the guard the nervous system has kept active since you learned to protect yourself by locking the center.
Lie on your back, knees bent, feet resting on the floor at hip width. Place one hand on the lower abdomen just above the pubic bone and the other on the right iliac crest. Let the air leave slowly through the mouth as you feel the abdomen descend toward the spine, without forcing, simply allowing tone to soften, like snow melting in the sun. Stay here for 10 slow breaths, sensing the pelvis soften from within. You may notice a deep softening in the groin, a yawn that rises without warning, tears that fall without sadness, or warmth moving down the legs as if something old were being released. Some bodies tremble lightly, others sigh deeply, others simply grow quiet. What matters is not what appears, but allowing it to appear, without interrupting, without judging, without needing to understand. The psoas holds memory, and when it lets go, the entire body recognizes it. You have crossed the 3 layers that prevent hip degeneration and the need for a prosthetic. Repeat this every week: rotation to nourish, stabilization to support, decompression to release, and you interrupt the path of degeneration before it becomes a sentence. Ignoring this weekly care is choosing years of physical therapy and slowly guiding the body toward the surgical table. The hip now has restored circulation, deep stability, and active decompression. The most reliable physical markers are reduced morning stiffness, less fear of rotating, and the ability to walk without having to negotiate with your body. To anchor this, place your hand on the hip bone, make a small internal micro-rotation, and release 3 low breaths. This subtle gesture can be repeated anywhere. When you feel stiffness returning or notice the body locking upon waking, return to the first layer and move through the rotations slowly. It will not always be necessary to complete all 3 layers. Sometimes, simply nourishing the rotation is enough to reactivate circulation and remind the nervous system that it can trust movement. Turn this into a weekly ritual, not an emergency, and the hip stays alive. If this work resonates with you, like the video, subscribe to the channel, and turn on notifications to keep receiving practices that restore autonomy to the body. The guide Healing in Motion goes deeper into this territory of somatic restoration. The link is in the first pinned comment. Every gesture shared here supports the continuity of this work and reaches those who are still seeking this clarity. Leave a comment saying, "I nourish my hip every week and prevent degeneration." Writing this anchors the commitment in both body and memory, making the gesture more real. There is more content available, and you can access it by clicking the video on the screen. The hip is not a faulty part. It is the axis that returns to supporting life when it receives the movement it lost.